Hi friends, this is Ela. Welcome to Happy Nursing. Today we will discuss about different nursing theories. Now what is a theory? A theory is a set of principles on which an activity or a profession or a discipline is based. A theory provides us with a statement which is like a formula which we can apply almost everywhere into our practice. Now there are different kinds of nursing theories like environmental theory, self-care deficit theory, human caring theory, etc. So today we will discuss about Nightingale's environmental theory and Paplau's interpersonal theory. Let's get started. So before going into the theories, we will be looking into the meta paradigm of nursing, which includes person, environment, health and nursing. Now you must be thinking, what is meta paradigm? Paradigm means pattern, and the pattern which shapes the education, research and practice of a discipline, in this case nursing, is known as meta paradigm. Here person is the client who is the recipient of care. This not only covers the client but also things like his or her spirituality, culture, family and friends, socio-economic status, etc. Environment means the surroundings of the patient, what interactions he or she is having with the visitors, etc. Health refers to the quality and wellness of the patient and what kind of access the patient has to health care. Nursing meta paradigm refers to the nurse and how he or she will apply his or her knowledge and skills while caring for patients. Nurses should always apply these four paradigms to the nursing process when caring for patients in order to address the patient care as a whole. The first theory which we will discuss is the environmental theory of nursing given by Florence Nightingale. Those who have seen my previous videos are familiar with how Florence Nightingale improved the health of soldiers and reduced the mortality rate during the Crimean War by just providing a clean environment. There is a link in the description box below for those who have not seen. She strongly believed that environment is an important factor to cure a patient. The main features of this theory were that Florence differentiated between practice of medicine and practice of nursing. How? She told that nurses should focus on the care and not the disease. Yes, that doesn't mean she will not know the disease. Obviously, she should know the basics of the disease, but it's not important to have full in-depth knowledge about the disease like a doctor. Another important thing is that, friends, you may have experienced many of your relatives saying to you that, oh, you are a nurse, so you administer medicines, right? Or, oh, you are a nurse, so you just follow the orders of treating doctors, right? If I am not wrong, many of you can relate to this because most of them don't have the knowledge of the aspects which we have to keep in mind while nursing. Florence didn't limit nursing to only administration of medications and treatment. She viewed nursing as a holistic practice of improving clients' health by providing fresh air, light, warmth, cleanliness, a quiet environment and adequate nutrition. Nightingale put forward her descriptive theory, which allowed nurses to relate their clients' health condition to their environments, the way which she used in the battlefield of Crimean War and improved hygiene and sanitary conditions there. Now this is very evident that environment does affect our health. For example, we have often seen patients living in an unclean environment with very limited entry of fresh air and light are susceptible to infections. If you don't keep your diet proper, you will not get the adequate strength to fight the disease. Again, let's consider you are a patient and there is so much noise in front of you whole day. You will definitely be irritated and it will interfere in your recovery. So you need a quiet environment to relax and take proper rest. She gave immense importance to assessment. Our nursing assessment is multidimensional and it contains points like allergic history, family history, occupation of the patient, marital status of the patient and many more things. Many a times we do the full physical assessment and ask questions about any pre-existing tumor or lump which we may come through. Sometimes people get irritated to answer so many questions and they just think these are useless and we are wasting time. But Florence identified the importance of assessment. She said that assessment is not just a heap of miscellaneous data, but facts which we can use for saving life or increasing the comfort level of client. For example, a patient has come with a fever. He may think while assessment that what's the need of checking so many things? I have a fever, just give me an antibiotic, that's all. But suppose we come across a deep cut or wound in the patient's leg. That cut may be infected and can be the actual cause of fever. So now we have to know from where did he get that cut, whether he had any tetanus toxoid vaccine in the last 5 years. Before giving medicine, we need to know his allergies. If he says he has a tendency to get deep cuts often, then we have to check his platelet count. Ask him whether he is on any steroid medication because they weaken the skin and blood vessels. We have to ask him if he has any family member with the same problem. So you see, there are plenty of things to ask, check and observe. If we find that he has a heart condition or a stent in his heart while assessment, then we will avoid certain medicines like aspirin. So assessment ultimately saves his life. Again, if we observe he has one-sided weakness or hemiplegia or arthritis or foot problem, we will keep that in mind in future while attending the patient and institute measures accordingly. For example, avoiding the weakened arm during sampling, provision of a wheelchair, etc. So assessment also increases comfort level. So this was all about Nightingale's theory. Next we will discuss about Hilgard Paplau's theory of interpersonal relations. Hilgard Paplau was an American nurse who was the only one to serve the American Nurses Association as executive director and later as president. She became the first nursing theorist since Florence Nightingale. She emphasized on the nurse-client relationship. According to her, the nurse should form an interpersonal relationship with the client instead of passively following doctor's order. This theory has 4 phases: orientation, identification, exploitation and resolution. In the orientation phase, the nurse and client both meet each other. They are strangers and the first step is to introduce themselves with each other. Here the client will tell the nurse about his problem and the nurse will decide how to handle it. Added to that, the client also tells about his past experience and preconceptions. For example, a client is admitted with a fracture in his leg. First he will tell his problem, whether he is having any pain or tingling sensation or weakness or whatever symptoms of any other organ, etc. Then he will share his past experience, that a few years ago I got another fracture and it was very painful, the recovery was very difficult, like this. Then he may share his fear, that what if I cannot walk again, how much time will it take to cure, will it be the same like the before one, etc. These are the preoccupation. Now the nurse should listen to him, identify that he is fearful, explain the procedure that she is going to do, explain the side effects that he can have, as well as use the available resources with her to ease his discomfort. Next is identification. In this phase, the client works interdependently with the nurse, takes her professional assistance when needed and begins to feel stronger. The feeling of helplessness and hopelessness, the fear, will decrease now. He will start to feel more capable of dealing with the problems. For example, soon after the fracture, he was very worried that how will I recover, what if the process is very painful to go through, how will I do my self-care activities, what if I cannot walk anymore, this and that. But then with the assistance of nurse, he becomes more familiar with the way of doing the activities of daily living like bathing, brushing teeth, etc. with a broken leg. This gives rise to a stronger feeling in him that yes, I can deal with the problem. Next comes the exploitation phase. Here the client makes full use of the services and benefits offered to him. He becomes dependent on the nurse and considers himself as a part of the helping environment. Like he seeks nurse's help in each and every job and makes it a habit. Sometimes he even asks for minor requests. Nurse also helps the patient in every possible way within her professional constraints. Lastly, the resolution phase. Here the patient gives up his dependent behavior and the relationship ends. Sometimes this phase is difficult for both of them due to the bond that has grown in the past few days. But ultimately the patient breaks the bond as soon as he realizes that he doesn't need any professional assistance now. So today we learnt about the meta-paradigms of nursing, environmental theory of Nightingale and Paplau's theory of interpersonal relations. In our next video, we will discuss about other theories. If you find this video useful, then please like and share this video and subscribe my channel. Thank you for watching.